How do you sleep after Voluma or after a filler injection? In general, there shouldn't be any restrictions, but sometimes we use a technique where we try to give a lot more structure on the cheekbone instead of the middle of the cheek. And that's when we let the patient know not to sleep too much on their side or put too much pressure on their side, because we just put filler there that it may be a little uncomfortable because it's going to be a little sore, so just putting pressure just gives more pain that you don't have to, but at the same time it may move a little bit the filler. So it's not that you have to have a specific position, but depending on where we place in the filler, especially on the sides, we try to mention not to put pressure, either like massaging and putting pressure in that area, or when you sleep in and then putting pressure when with the pillow. So if any case we tell you try to avoid putting pressure on the sides, or try to sleep more on your back so you don't put pressure also in the sides of your face. So if a provider tells you that you need to be careful a little bit with the pressure that you're putting on your cheekbone, either massaging or like sleeping position, it's better to wait, for example, 2 to 3 days until the fillers blends in, and then you can go back to your normal activities. So something that you can use to minimize swelling is using ice, either like an ice pack that is going to help prevent that swelling, and you wanted to do it for maybe 5 minutes for the next couple of hours, and only for the first day. It's important, it prevents the swelling, but after a day, it doesn't make any difference. Sometimes after a filler injection like Voluma, because it's placed at the cheekbone, it may cause some soreness. You can take Tylenol if it's too much discomfort, but at the same time, it shouldn't be. It's just like a little discomfort, more because of the prick, but the pain shouldn't go up. It should just actually get better and better. So in general, for Voluma, because of the place that it gets injected, when it's injected on the cheekbone, we tend to tell the patient to avoid massaging that area. It might be that it's a little bit more tender, so why would you cause more pain? And then the other thing, try to avoid, for example, sleeping and putting pressure in that area, because it may shift a little bit the filler. It's not that it's proven that just putting pressure is going to completely move the filler away, but at the same time, it's just better to do it for a couple of days and then be done.